All right, so for quite a while here in Good Day Chicago, we've been talking about the long haulers. These are people that are left with symptoms long after they've contracted COVID. And we've talked about that brain fog, a lack of a sense of taste or smell. But what about other aches and pains? This is really fascinating. We're joined this morning by Dr. Joseph Pergolizzi. He's with Healthy Directions. And doctors, I say good morning to you. This sounds like something that maybe a lot of us, and this may have happened to me, where we're experiencing acute or chronic pain, and there may actually be a causality with COVID here?
That's correct. You know, we've found in the clinic and also in the literature is that patients are reporting a lot of what we call myositis. That means muscle pain and inflammation, and myalgia, which means pains in your joints. And this is common with viruses. You know, when the virus infects the body, the immune system fights back and can cause this type of inflammation.
Well, let's talk specifically, because apparently there are four surprising sources of muscle pain. What do you want our viewers to know?
Yeah, it's really important to understand that on top of the fact that you get this virus, you're stressed out. So stress, dehydration, poor nutrition, and lack of sleep, all those things are going to happen when you are unfortunately affected by COVID-19. And this will compound the type of sort of negative overall feelings and joints and muscle pain that you have.
You know, we've been talking ad nauseum almost about stress around here and COVID, because we're all stressed out, and that's not going to go away anytime soon. But you know what I'm fascinated by is I don't think there's been a lot of conversation about how we can mitigate some of these issues with diet. Because a lot of us, especially here in America, we eat too much brown food, right?
That's true. Yeah, so when you look at it, there are 3 ways that you may be able to address some of this muscle and back pain without going to a doctor. One of those ways is to have good exercise. So take a break, go to the gym. Take care of your need to move around, stretch and flex. Stretch breaks, even at work. You know, you've been up all morning, I'm sure. Just get up, stretch. Sometimes people will take their shoes off and they'll ground. That's where they just dig their toes into the floor or into the grass, and this is very good. And then finally, natural topical relievers. You know, topical pain relievers are very helpful because they work right where the pain is. They're usually faster onset than taking something by mouth, and they also can be used quicker a second time around than usually those medications that you're going to get over the counter and use by mouth.
And real quick, before we run out of time, a lot of folks have been avoiding the doctor's office because they don't want to get COVID. When is the time to go see the doctor?
Excellent question. You know, if you have trouble breathing, high fevers, neck stiffness, extreme pain, this is when you do want to see your doctor.
All right, Dr. Pergolizzi, we're going to have to leave it there, but great advice. Appreciate your time this morning.
Thank you.